Ladies and gentlemen, thank you so much for allowing me to interrupt your conference and to address you in this way. I think I need not convince you that health and well-organized healthcare are absolutely crucial in our society. I would say even more today. The current energy crisis in Europe, with rapidly increasing monthly bills for so many people, have made it ever more important that healthcare remains accessible and affordable to all. The last thing we need right now is that people must compromise on their health. Clearly, our responsibility as health ministers means that we must do everything we can to ensure that healthcare remains affordable. We must safeguard it for the financially vulnerable, but also for people who might be in between, but also experiencing financial difficulties today. In Belgium, we have long taken it for granted that we can count on top-notch, affordable, accessible healthcare that we collectively organize and fund. We should not be complacent. We should not only increase our efforts to protect our people, our patients, we must also strengthen the healthcare system itself. This means investing in it, investing in extra manpower and training, better wages, better working conditions for our healthcare staff, and in affordability to guarantee the best possible care for every patient. But investment must go together with reform. We must invest in a targeted way, intelligently, efficiently, to pilot our healthcare system into the future in a robust way based on the goals laid down by the Quintuple Aim. When it comes to discussing our healthcare budget, this means that we should really start from public health priorities and derive from that healthcare priorities, rather than putting together a budget that is the aggregation of bargaining results in different sectors of healthcare, as it often is. This is an important change in the mindset, in the culture, in the approach in our healthcare system, which we try to make today. It's not an easy transition, but I think it's absolutely fundamental that the healthcare budget is premised on public health priorities and healthcare priorities, not simply on, let's say, what interests dictate. In terms of the delivery of our care, we must ensure there is more collaboration to achieve integrated care. One of the important issues we also face with is that requires exchange of data. This is a difficult topic that most likely will come up in your discussions, and we are working hard, for instance, on the concept of a Belgian integrated health record. Let me say a few words about this. The Belgian integrated health record should support the goals of the Quintuple Aim. It's not just a technical ICT operation. It's about the Quintuple Aim. It should contribute to that kind of paradigm shift in healthcare, where the focus is on the citizen or the patient, the healthcare team, and the continuity and the quality of care. The team that is working on the Belgian integrated health record is well aware that mental and somatic health and well-being need a holistic view, and sometimes a view over the whole life cycle of the patient, including on the social, economic, environmental context. The Belgian integrated health record is premised on a number of objectives, which also define a cluster of projects in our e-health roadmap, such as the empowerment and the activation of the citizen, the patient, and the healthcare provider, the promotion and support of multidisciplinary collaboration across healthcare lines, the realization of specific services such as clinical decision support, referrals, and administrative simplification to ease the workload, and the support of the secondary use of data for population management, prevention, policy making, innovation, and medical product development. Under the quality law, legislation on the quality of our healthcare provision, every healthcare provider must have access to patient data through the Belgian Integrated Health Record, data that should be relevant in the context of the therapeutic relationship and the provision of quality care. The first phase is intended to create a coherent framework where each type of integrated patient record is comparable and where relevant data can be drawn from existing patient records. We must gain solid support for such an integrated and multidisciplinary health records. And obviously the position of general practitioners is essential in this regard. Also thinking on the way we should organize unplanned care outside normal working hours. Ladies and gentlemen, a comprehensive response to this challenge also presupposes reforms in the medical practice itself. Administrative burden must be reduced. For example, the so-called sick note that Belgian general practitioners must write so often should be limited. For the first time, we are now reining it in. Maybe not sufficiently so, but we are taking first steps against strong resistance in some corners. We should also promote collaboration. Collaboration between doctors' practices and within doctors' practices. It must be evident that the general practitioner can rely on collaboration with other health professionals, nurses, psychologists in his practice. And he should have, or she should have, stronger organizational support. That is, amongst other things, what the New Deal for general practitioners that I propose is about. And obviously we must go beyond collaboration between general practitioners. We need smooth collaboration and mutual support between hospitals and the first line, between hospitals and residential care centers. Collaboration, integrated care, that is the way to go, in the interest of all patients, all citizens, and in the interest of all healthcare workers. I thank you for listening and I wish you much success in your conference.